Have you ever wondered why something that seems so simple can make such a big difference in intimacy? After talking with older couples for years, I've noticed that many men assume good foreplay is mostly about doing more. More touching, more intensity, more trying to impress their partner. But that isn't usually what makes a woman feel most comfortable, connected, and ready for intimacy. In fact, one of the biggest mistakes I see is something much simpler, moving too quickly. And today, I want to show you what many women actually value during those first moments of closeness, why rushing can work against you, and how a few small changes can make intimacy feel more natural for both partners. My name is Dr. Narita, and for the past 16 years, I've had the privilege of helping thousands of older men better understand their health, confidence, and quality of life. I work with men every day who want to stay healthy, connected, and confident as they age. So, if you find this conversation helpful, take a moment to like the video and subscribe. And I'd especially love to hear from you in the comments. What do you think is the biggest misunderstanding men have about intimacy as they get older? Now, let's start with something that may surprise you. For many women, foreplay does not begin with physical touch. It can begin much earlier. It may begin with feeling listened to, feeling appreciated, feeling emotionally safe, feeling that her partner is genuinely interested in her, rather than simply trying to reach the next stage of intimacy. Think about it this way. If you were preparing for a long drive, you wouldn't slam your foot on the gas before the engine had a chance to warm up. You would give the car a little time to get ready. Human intimacy can be similar. The body and mind often need time to shift away from the distractions of the day and toward closeness. That is especially important as couples get older. Stress, fatigue, medications, hormonal changes, relationship tension, and changes in circulation can all affect sexual response. That doesn't mean intimacy has to become less enjoyable. It simply means the body may appreciate a little more patience. And here is where many men get confused. They think slower means less passionate. It doesn't. Slower can actually mean more attentive. Instead of trying to guess what your partner wants, pay attention to her response. Is she relaxed? Is she engaging with you? Does she seem comfortable? Is she moving closer? Or does she seem distracted? These small signals can tell you much more than any universal list of the perfect technique. There is no single form of foreplay that every woman secretly wants. That idea is important because every person is different. What one woman enjoys may not be comfortable or appealing to another. Age, health, relationship history, stress, body image, medications, and personal preferences can all play a role. So, rather than searching for one magic move, learn to communicate. And communication does not have to ruin the mood. Sometimes a simple question like, does that feel good? Or what do you enjoy? Can actually create more closeness because it shows that you care about her experience. There's another mistake worth discussing, and it has nothing to do with technique. It's treating foreplay like a checklist. When intimacy becomes a sequence of steps that you are trying to complete correctly, you can lose the most important part: connection. Think about dancing. You wouldn't stare at a written list of dance moves while your partner is standing in front of you. You would pay attention to the rhythm and respond to the person you are with. Intimacy works much the same way. Your goal is not to perform perfectly. Your goal is to notice, respond, communicate, and allow both people enough time to feel comfortable. And there is one particular factor that can make this even more important for men over 50. It has to do with changes in the body that are completely normal with aging, but that many couples misunderstand. Once you understand that change, you may look at intimacy very differently. That change is the way sexual responses can become more gradual with age. For many men, erections may take longer to develop, may require more stimulation, or may not be as firm or predictable as they were decades earlier. Women can experience changes too. Vaginal dryness, changes in hormone levels, medications, stress, and other health factors can affect comfort and arousal. None of this means intimacy is over. It simply means that the old approach may need an update. This is one reason patience becomes so valuable. If a man expects his partner's body to respond immediately, both people can end up feeling pressure. And pressure is rarely helpful when you are trying to create closeness. Instead, think about creating an environment where neither person feels rushed. That might mean putting away the phone, turning off the television, talking for a few minutes, sharing a kiss, holding each other, or simply giving your partner your full attention. These things may sound ordinary, but they can have a powerful effect on how connected a couple feels. And there is something else I want you to understand. A woman's comfort is not a side issue. It is part of intimacy itself. If there is pain, dryness, fear, embarrassment, or uncertainty, the right response is not to push through it. Slow down and talk about it. For women experiencing vaginal dryness or discomfort, a healthcare professional can help identify possible causes and discuss appropriate options. Some women may benefit from a personal lubricant or other treatments, depending on the situation. The same principle applies to men. If you are having persistent difficulty getting or maintaining an erection, don't automatically assume it is simply because you are getting older. Erectile problems can sometimes be associated with conditions such as diabetes, high blood pressure, cardiovascular disease, medication effects, or other health concerns. That is why intimacy can sometimes become an unexpected window into your overall health. Now, let's return to the question in the title. What do many women actually want from foreplay? The answer is not one secret technique. It is attention. It is responsiveness. It is feeling that her partner is present rather than distracted. And perhaps most importantly, it is feeling that she does not have to hurry. One of the simplest things a man can do is notice what his partner is communicating without words. Maybe she becomes more relaxed. Maybe she moves closer. Maybe she smiles or initiates more affection. Or perhaps she becomes quiet, tense, or pulls away. Those responses are information. You don't need to be an expert at reading body language. You simply need to stay attentive and be willing to adjust. And please remember this. Asking what feels good is not a sign that you lack confidence. It can actually demonstrate confidence. You are saying, I care about your experience and I want us both to enjoy this. That attitude can change the entire tone of intimacy. There is also a misconception that older couples need to recreate the sexual experiences they had in their 20s or 30s. I don't think that is a useful goal. Your body is different now. Your relationship may be different. Your priorities may be different, and that can be a good thing. With age, often comes something younger. Couples are still learning. The ability to slow down and appreciate the experience instead of treating intimacy like something that has to follow a particular schedule. So rather than asking, how can I make this more intense? Consider asking, how can I make my partner feel more comfortable, connected, and understood? That small change in mindset can be surprisingly powerful. But there is one more part of this conversation that many men completely overlook. It involves what happens before physical intimacy even begins, and it may explain why some couples struggle despite having plenty of affection between them. That is where we're going next. Sometimes, the most meaningful part of foreplay happens long before either person is thinking about sex. It happens in the ordinary moments of the day. A kind word, a genuine compliment, a little affection in the kitchen, holding hands while watching television, asking your partner how her day went, and actually listening to the answer. Those moments can create a sense of connection that carries into the bedroom. And this matters because intimacy is not just a physical response. Your brain is involved too. When you feel relaxed, respected, and emotionally connected, it can be easier to be present and enjoy closeness. That is why I encourage couples not to measure intimacy only by whether an erection happens quickly or whether intercourse happens at all. There are many forms of affection and sexual intimacy. Sometimes, the most satisfying experience is simply being close without putting pressure on either person to perform. This can be especially helpful for men who become anxious when their erection does not respond exactly as expected. The more you think, I have to perform, the harder it can become to stay relaxed. So, take the pressure off. If your body needs more time, give it more time. If your partner needs more time, give her more time. And if either of you is uncomfortable, stop and talk. That is not failure. That is good communication. Now, there is another practical point that deserves attention: the difference between stimulation and sensitivity. As we age, sensation can change. Some people may need more gradual stimulation, while others may prefer something gentler. There is no universal rule. This is why copying something you saw online or heard from a friend can be misleading. Real intimacy is personal. Instead of asking, "What is the best technique for women?" ask, "What does my partner